Hello, my name is Mia Foltz. I am a nurse at Hershey Medical Center and a nursing student at Millersville University School of Nursing. I'm going to present today some of the disadvantages or the possible downside of having tattoos and piercings in the workplace, specifically within healthcare. So, starting off, there are some issues with how people are perceived when they have tattoos. Based on polls and surveys, some people have found that people with tattoos or piercings are found to be more deviant or more likely to engage in negative behaviors. Additionally, people with tattoos or piercings are shown to be perceived as having lowered inhibitions or more likely to engage in behavior that is questionable compared to people who don't have tattoos or piercings. Additionally, people with tattoos and piercings have been shown to be perceived as more rebellious. So, looking at nurses or healthcare workers in general, these are not characteristics we would classically think of as a good nurse being rebellious or deviant. So, just thinking like generation wise, most of our patients are older individuals if we're working with if we're not in like a specialized pediatric population. So, especially that older generation tends to perceive tattoos in this manner. So, looking at employment and how we want our employees to be perceived, nurses are classically thought of as the most trusted profession every year. So, having tattoos and piercings may alter this perception and may decrease the amount of trust that our patients are putting in nurses and healthcare workers, which is a potential downside of having tattoos and piercings in the workplace. In addition, these studies also found that women were perceived more harshly if they had tattoos or piercings, and the majority of nurses are women. So, this is another factor to consider when evaluating the pros and cons of tattoos and piercings amongst nurses. So, another study found that tattoos and piercings tend to alter team dynamics in the workplace. So, one study found that tattoos were more likely to create a stigma and social divides. Nursing is really dependent on teamwork, so this is something to consider when employing individuals with tattoos and piercings. It does, for better or worse, tend to create a perception and a divide maybe among coworkers of people who have tattoos and piercings and those without. So, creating this stigma may lead to increased negative workplace dynamics and divides amongst employees. So it is something to think about when employing individuals, what kind of environment you're looking to create if you are someone who believes that tattoos and piercings do alter social dynamics. Additionally, there are some potential issues with employment among people with tattoos and piercings. It's completely legal to fire or choose not to employ someone for not complying with physical standards. So, if you think of, there's a lot of classically standards for hair color, and um, that is allowed to be asked of your employer. They are able to ask you to change your hair color to comply with the standards for the workplace. So there is no retribution for not hiring or firing someone due to their inability to comply with the physical standards of workplaces. So if your employer says no piercings or no tattoos, that is completely legal and okay for them to do. So people with tattoos and piercings may find it more difficult to retain employment or even obtain it in the first place. So this is a potential issue. Amongst nurses, it's definitely more acceptable these days, but in some hospitals, it is completely legal for them to not employ you or to choose to terminate your employment due to an inability to comply with the physical standards. So those are some issues with tattoos and piercings in the workplace. It's definitely a hot topic, and even though many of us have tattoos and piercings, there's still a widespread stigma and taboo about this issue. So here are some references. Thank you for listening to my perspective on this topic.